Our goal is really simple, but really important. So what we wanted to do was to provide an opportunity for people to get a clearer picture of what you should be looking for when you're trying to make a decision as to whether or not you need more help for a family member who might be presenting in some kind of emotional or behavioral distress. And then we also wanted to be able to make really much more clear to you what the various resources are in our community and how you can access them, because we are really rather proud of the resources that we've got, and they're born of a lengthy history of cooperating together the way Windsorites do to try and make sure that we're looking after the members of our community better. So just some basic information, which probably all of us at this point are aware of because there's been a lot of information campaigns. 1 in every 4 Ontario youth younger than the age of 19 will experience a significant emotional or behavioral or mental disorder over the course of their youth. And when we say mental disorder, we're talking about a level of distress that gets in the way of normal day-to-day activities. So one of the things we know is that if kids can get help early on, it really very much reduces the likelihood of there continuing to be mental health problems for that person later in life. And that makes sense because we all know little kids and adolescents have lots of room to make changes for the better in their lives. But we do know that emotional and behavior crises, if we don't respond and get help in place soon enough, can get in the way of participating in normal activities of life that help you to feel better about yourself, help you to make friendships, help you to challenge yourself to take on education and move away from home and do the things that you should be able to do with your life. So when we look at what kind of gets in the way of people seeking help, these are the kinds of things that come up. So part of it is just knowing when and how to seek help. So one of the things I think about when I look at that issue is that it's very easy for us as parents, I think, when we have a physically sick child. We're usually better able to figure out when we should turn to professional help. And the system for providing professional help is one that we're all pretty acquainted with. So even if we don't have a family doctor, we know where the walk-in clinics are. We know that if we're in a crisis with a physical health problem with a child, we can ultimately go to the ED, and we know we're going to see a physician there and get an opinion. When you're looking at whether or not the signs and symptoms you're seeing in your child that appear to be emotional and behavioral distress, it can sometimes be harder for parents to think, well, is this just like a normal kind of blip in an adolescent life? Or is this something that I really can't handle myself and need to seek help to address? So that's part of what we'd like to look at tonight. The other thing is that it's hard to know where to go. And we've worked so hard in our community to try and streamline the resources as much as we can. But it still can be pretty confusing. And the parallel I always think is I always know that if I were trying to find help for my adult children, you can imagine my kids are adults at this stage of the game, I would probably, even me, and I'm in meetings with people from the adult system, have a much harder time. So if you're not in it up to your ears all the time, it's hard to know where to seek help. So we want to address that today. And then it's kind of like, are you making too big a deal out of something? So you're reluctant to seek professional help in case really you're going to label your child in some way and that you shouldn't do that. So that worry about labeling your child leads into concerns around stigma. And I know that we all were aware of the Bell Let's Talk campaign, and there are many government-sponsored campaigns to try and help us to understand that there should be no shame attached to acknowledging that you have a mental health or emotional problem. But that still continues to be present for all of us, I think, in our community. So that can mean it's harder for you to accept to go and get help. Nobody is ashamed to call their neighbor and say, you know, my 4-year-old's running a fever. I can't keep the fever down, but I've got 2 other small children. Can you come over and look after my children so I can go and get professional help for my smallest child? It's harder for us to countenance doing that if you have a child in an emotional crisis in your home. Who do you turn to for help, and are you going to feel embarrassed to seek that out? All right. So this is just a definition of what a mental health problem looks like. And it's really straightforward. It's what you probably could have come up with if we'd asked you to brainstorm it. It's a problem that's intervening that affects behavior, it affects emotions, and it affects your interactions and your perceptions of your world. What it means is that it gets in the way of your ability to function adequately. So for young people, that means it gets in the way of their ability to leave their home when they probably should be and see friends and do things that would be normal to do at that age. Gets in their way of their ability to go to school, remain in school, feel successful in school, feel in charge of themselves at school. One of the big things that's the real clincher for us is trying to determine, is this an illness that's unfolding, or is this just, and I shouldn't say just, is this distress? So what I would say to you is, sometimes it's hard to tell, and so my simple answer to you is, if it's distress, there is absolutely no harm in accessing a next day appointment at a walk-in clinic to get an opinion. So we have the virtue, and Crystal will talk some more about the range of resources that are available on that walk-in clinic basis. We're now in a place where parents don't have to be all by themselves at 9 o'clock at night thinking, I don't know whether I should go to the hospital or whether I should wait till tomorrow. You could think to yourself, as long as I can keep my child safe, you know, they may be miserable and we may not get a lot of sleep, but as long as I can keep them safe, tomorrow morning there's going to be somebody else I can talk to. So that's a huge difference, I think, and it makes an important resource available to our community. What you need to think about is also your own family history. So I always say to people, if you have a strong family history of depression, if you have a strong family history of anxiety disorder that you're aware of, and your child has been struggling for a period of weeks with getting out of the house, coping with demands at school, managing to sleep through the night, all the things that would distress us as we watch that going on for our children, then that ramps up your concern towards maybe thinking about it as an illness. So think about it in those terms. Use your judgment in terms of, is this just somebody's broken up with somebody and the friends are not being all that supportive and this is an unusual but intense distress, or is this something that's really eroding your child's ability to function? And that's when you start to think, I got to get an opinion here. We got to do something about this. So I've alluded to these, and I won't spend a really long time because I think it's important we get over to these guys to talk about the services that are available. But what we do know, and it's more and more all the time, is we understand the brain chemistry behind emotions and mental health problems. We know that mental illness is caused by a combination of things. It's caused by a biological predetermination, that thing I talked to you about in terms of, is there any family history? Is this something that's running in your family here? And social stressors. It's called the diathesis stress model of illness, and it applies to all illnesses, actually. So your system is under stress, and there are kind of biological things that are there already genetically that sort of wait and can click and trip, right? So that's why you can sometimes think, well, one child can go through a tremendous stress that any of us would think was horrendous, the death of a parent, for example, and not be triggered into a depression. Another child can have a loss of a friendship, the breakup with a boyfriend, marital stress in their parents' relationship, and end up with a major depressive disorder. So it's a question of both those things being present that trips that mental illness. So I mentioned this before as well. So when you're thinking about a mental illness, it's because it's in your brain, it affects so much of how you function. So we're learning more and more about which parts of the brain determine and interface with one another to control emotion and thinking and perception. We also know that when a person is struggling with a mental illness, whether it's depression or anxiety or psychosis, a major mental illness where thinking is really skewed, that is a function of brain chemistry and genetic determinations in your brain, and therefore it's going to affect all the things your brain operates with, right? Which is so giant. So it's going to affect how your emotions the intensity of your emotions, how you can manage your emotions, how you can use your thinking to make sense of your emotions and to make sense of your world and what's going on around you. It can affect your behavior so that you might become more jumpy, more slow, less able to get out of bed. So there's a huge range of things that it will impact. It can impact your eating, all those basic biological functions, because we're so brain-driven, right? That's our big resource, can also be the thing that makes our lives more difficult when there's a problem with it. So one of the things I try and say to people is, if you're wondering whether your currently irrational child is mentally ill and I should take them immediately to the ED, try and think about a time in your life where you had a huge catastrophe happen, and think about how well you could make sense of it right then and what you needed from the other people around you. So my example of this would be when my mother died and I had come home for the funeral and I was driving back to Saskatchewan and I got lost leaving the city of Winnipeg. I had been there for 35 years. So I knew how to get between Winnipeg and Saskatoon. But I was lost because I was in the midst of such intense distress that I couldn't think, I couldn't perceive, I couldn't think, I couldn't make sense of anything except misery, and ended up being the RCMP pulling me over to say my husband wondered where I was. So for me, that helped me in that now, as I've worked with young people and with my own kids in my family, there are times when kids are totally irrational, like I was, because of distress, and what you need is somebody to help you feel safe. Calm you down. I loved that RCMP officer. It's practical. I followed him in my car. And then I was okay again, right? So think about that, and then we'll talk to you about resources that can really help you to sort it out, okay? And these are the 5 questions, and then I'll turn it over. Ask yourself the following things when you're trying to decide, is this an illness? Is this something that requires a professional? Is there a family history of mental illness? Do the concerning behaviors continue to be present over a significant length of time? And you'll know as a family member, as a parent, this has been going on too long. That's what you hear yourself saying. Are the kids' behaviors and emotions kind of normal for a child of their age, right? Is it out of proportion to what you'd think would be normal, or is it, yeah, it could go this way? Do the behaviors interfere with the kids' activities day to day? So is the young person still able to get up and get going and keep going, or is it shutting them down? And are they at risk of harming themselves or someone else? So those are the big 5 questions.
So we want to discuss resources where you can reach out when you are concerned about your child or youth. So we would encourage you to talk to, if you are noticing something that's ongoing, and we always believe that, you know, parents and families know their children best. So if you are concerned, you can go to your family doctor if you have one and talk about what you're noticing. The pediatrician or family doctor may feel more comfortable referring you on to a child or adolescent psychiatrist. In our community, we do have several psychiatrists that specialize in children and adolescents, and they'll be able to meet with your family, go over family history of mental health, how are they functioning at school, how are they functioning at home, and discuss a treatment plan with you and your family. There's a lot of different contributing factors to mental health, like Janet was mentioning. They're all here. We want to know, are the behaviors and symptoms across the board, or is there certain areas that your child is struggling in? But we always say, if you're concerned, certainly make that appointment and talk to your doctor about it. There is a lot of questions around, what does a psychiatrist actually do? A psychiatrist is a doctor who specializes in mental health. The service is covered by OHIP, so it's different than a psychologist. This service would be covered. They would spend about anywhere between a half an hour to 1 hour doing an assessment with your child, including you as a caregiver, in the assessment, and then determine whether or not medication might be recommended, or any other kind of treatment plan. So individual and family counseling is another option that would be discussed for your child or youth to be able to connect with somebody and work on specific goals that they may be trying to form. Confidence, self-esteem, dealing with depression, anxiety, all of those are pretty common. One other thing is a psychiatrist may, after meeting with your child or youth, they may refer back to family doctor to monitor, or they may schedule a couple follow-up appointments depending on the need. So these are the resources that are available in our community. If a child is 0 to 6 years old, Children First would be the place to go to. Children First is, they have a counseling clinic, and they have in-home workers that can go out to the home, do behavioral assessments, speech therapy, any kind of developmental concerns you might have. Regional Children's Center is where I'm employed, and that's under Hotel Dieu Grace Healthcare. We offer treatment for everybody ages 6 to 17, and I'm going to talk about our walk-in clinic after. It's a really good resource. It's not a medical clinic, but it's a counseling clinic, so we'll mention that again. And then Maryvale has, sorry, I should have mentioned Regional Children's Center. We also have a day treatment program. So if a child or youth is really struggling in a school setting, we have a day treatment program where the child or youth would attend school at the Regional Children's Center, and there's child and youth workers, social workers, and it's really focused on mental health services as well. So it's not so much focus on the academic part, but really getting the child and youth back on track and stabilized. There's a lot of communication as well. The goal is always to transition that person back to a community school if possible, and there's a lot of collaboration between the agencies to kind of discuss what was working well at this school and how can the community school integrate whatever it was that was working for that child. Maryvale is another place so Maryvale is where all of our child and youth psychiatrists work out of our Rotary program there. So you can go there for an outpatient psychiatrist appointment with a referral from your family doctor. They also have a day treatment program that's 13 to 17. So for high school ages, you could, same as the Regional Children's Center, but it's just for 13 to 17. And they also have outpatient counseling as well at Maryvale. So all of the services that I just mentioned are free, and so it can be confusing sometimes where to go. So we do have a handout available at the back that you guys can grab on the way out. We always encourage people, if you're not sure, just call us and ask. We do have we do have a lot of services to help families, and sometimes we find that people just weren't sure where to go or who to ask. There's 2 hospitals. So Met Hospital, that's where you would go if you have a youth in crisis from age 7 to 15 years old. So those are youth that are absolutely unsafe, they're posing a risk to themselves or others. That's when you would go to the emergency room with your child and ask to speak to a crisis worker. We're available any day of the week, every day of the year. We don't, holidays included, from 8 in the morning until 10 o'clock at night. But that doesn't mean that if your child or youth was struggling after those hours that you wouldn't have anywhere to go. So you would go to the hospital, and the hospital can be used as a place of safety. So if something was going on after hours, then that's a safe place that you can go. If the child or youth is not able to get into a car and go safely, then that's when 911 can be contacted. And once again, that's for urgent safety issues that you're experiencing. And 16 and up would go to OLET campus, and they would see a social worker there who would assess and collaborate with psychiatry and the ER doctors to come up with a plan as well. If you are from the county, Leamington is also available, their emergency services. So what we would do from Windsor is just do it's called an OTN assessment. So using our cameras, we would be able to meet with you guys, meet with the family using the cameras, which is nice if there's any transportation barriers. So this is once again kind of outlining what I was just mentioning. One of the misconceptions sometimes is when a youth presents at the Met emergency room, a psychiatrist doesn't come to the ER, but we do consult with them over the phone and come up with a plan in that moment. So perhaps a child or youth may be needing an admission to hospital if that's what's recommended, or discharging with a safety plan. But we don't just look at what's going on in that moment, in that crisis situation. We're looking more at what does the youth or teenager need even after that. So follow-up services, counseling, how can we connect you and provide the support that you guys are looking for. Yeah, 16 and up goes to OLET. And I think, okay, so this is a little bit more services, sorry, for the adult. If you're 16 and up, Hotel du Grace Healthcare offers services from 8 a.m. till 8 p.m., 7 days a week. It used to be called the Transitional Stability Center, but it's now the Crisis and Mental Wellness Center. CMHA is another one, popular go-to for 16 and up once again, and they can work in collaboration with any, like with the hospital to help with further planning after that crisis is kind of, after you've moved on from the crisis. And these are the walk-in, so this is the walk-in clinic I was mentioning earlier at the Regional Children's Center. We have now expanded our walk-in clinic. It used to be 3 days a week, and now it's 5 days a week. So these are, if you're not sure, you would just walk in. It's a counseling clinic. You just come to the Regional Children's Center at 3901 Connaught, just on the west end off of Huron Church, and you show up. No appointment is needed, no cost for that service, and you ask to speak to someone. So that is if you have something going on, maybe a specific goal or something that you would like to discuss in that hour, or perhaps you just want to go and ask questions and say, you know, where do I go from here? And we encourage the child or youth to come as well, because their input into the conversations are really key. Counseling is a voluntary service, and we really need the youth to be on board with the services. In Leamington, there is also Maryvale does a walk-in clinic for our county people in Leamington at the hospital there, and the days and times. So that's for ages 13 to 17. Once again, walk-in, no appointment needed, and they would be able to talk with a social worker and assist that day, and hopefully determine a plan for follow-up as well.
Historically, I think everybody who's grown up in Windsor thinks Maryvale is a place for troubled teenage girls. And that the nuns were the ones that provided the care, and they did. It's an old agency, and so a long time ago that was the case. But the sisters have been gone for 20 years, and in the interim, we've broadened the services that we provide. I always say, well, we serve boys as well now, and there's a range of services. So the acute psychiatric inpatient beds are housed on campus, but the vast majority of the resources are outpatient services. So there's kids coming and going for outpatient counseling. The age range is from 12 years, 9 months, up to just before the 18th birthday. We do try to work with parents or guardians along with the young person, but that is something that the young person needs to work with us to give us consent for. Usually kids are pretty comfortable with including parents or guardians to some extent, so that is a bit of a difference between the Maryvale service as a children's mental health setting and the teen health center counseling service. We do intend to involve parents and guardians more, I think. And then, as Crystal said, we have a large day treatment program that provides services to kids who are suffering from anxiety and depression, oftentimes leading to long histories of school avoidance. I think that's us. Yeah.
So if a child or youth up to age 15 attends the hospital and it's determined that they're not safe going home, we would do an admission to Maryvale. So they have a hospital bed program there. There's 6 beds there. 16 and up would go to OLET campus. If they required admission, that would be at the psychiatric unit on OLET. The admission process is short term. The purpose of that is to stabilize, ensure that the child has de-escalated and there is the safety plan has been developed and everybody is on board. I'm trying to think of some questions. Parents sometimes are reluctant about medication, and those are all questions that can be asked to a doctor or a psychiatrist. There are oftentimes where kids can be admitted and medication may not be recommended. So we just always like to kind of once again, look at the family history, look at what's going on, and has counseling been tried in the past? Is this a situational crisis where maybe your child or youth is going through a breakup, like Janet had mentioned? And of course, we have feelings around relationships breaking up, and so we have to kind of see, is this something that's going to be ongoing and get in the way of their daily functioning, or are they just struggling with this issue right now and needing some support? So. Once again, if you don't know, it's always best to just ask and check in. The walk-in clinics are a really great option to use as well in those cases. At the Regional Children's Center as well, we have, so I do the crisis response with another full-time person, but we also have counseling services. We do groups, parenting traumatized youth group, divorce and separation. We have a psychologist that works with us as well. So we really want to figure out what your child and youth's individual needs are, and then providing the services. Teen Health Center and Maryvale are also options. We always encourage families as well, if you have access to private benefits, that's also another route that you can go to seek help as well. This is the information for the Teen Health Center. One of the differences for Teen Health opposed to regional children's centers, they also have medical staff on site. So there's doctors there, a dietitian, if there's any type of eating concerns, eating disorders, that might be a good option through Teen Health to have that medical staff on site as well. and they serve 12 to 24. All right, and this Charisse is from the school board, so she can talk about their services.
Well, thank you. Like Janet and Crystal were saying, we really do have a really close partnership. I actually used to work at the Regional Children's Center, and we developed a lot of protocols. So what would happen is, certainly, if we were sending, if the school board, our school board was sending anybody down to the hospital, with consent, what we would do is we'd actually, and nowadays, and certainly we would contact Crystal directly. And so if a social worker has assessed the student in the school, or a principal has let us know the information that what a student has said, is what we contact the staff member and let them know that they're heading down to the hospital, and then with permission from the parent too, we are getting the follow-up. So if the student is admitted to the hospital, they let us know, and if the student is discharged, and then I convey that information off to the principal. So it's really important, to be able to communicate, especially. I know that, and I've heard this over the years, it's really difficult to tell your story over and over again. And so for us, if we've already, as a social worker, if we've done an assessment in the school and the student has talked about a lot of things, it can be really hard to go on and talk to another social worker to say those same things. So by just providing a little bit of information and providing that support, I find that, it's more of a seamless type of approach. And certainly after the student is admitted if they are admitted to the hospital, there is certainly a seamless counseling services. Either they're referred to the Regional Children's Center, or they're actually referred to Maryvale. So they're automatically, if they're admitted to the hospital, there is services that are automatically available for them. Again, certainly, if you're involved with other community organizations, you could continue with those organizations. It's just that we want to make sure that our youth that are most at risk certainly do get the support. So with regards to the social workers in our board, we provide a lot of different services. So certainly what we do, the principal will contact us, and the thing is, we all have to have consents. So we have to make sure that the consents are formed, and then what happens is we will contact the parent and provide a little bit more information, because it really has to be informed consent, and knowing how long your information is held, and basically where at what point we might have to breach confidentiality. Again, if we're meeting with a student, we let them know that, again, if they're having suicidal thoughts, we have to let a parent know. If a child is saying other things that are like homicidal, or they're at risk themselves, again, there's certain things that we have to let other agencies know. So with regards, after the consultation with the parent, we can provide brief counseling services. We do have social workers assigned at every school, and so we do provide up to 6 sessions. Certainly if a child is at risk, especially with regards to suicidal ideation or anything like that, we do provide longer, but in that case, typically there's a referral already to a community agency, because the thing is, the amount of time that can take place, we want to make sure that we're able to see all students, and being in the school, sometimes students, and then we talk about stigma, but the thing is, we are in some schools, and the students do know that we're there that day, and so sometimes they don't like coming down because then other people might know, but certainly we are there, and we certainly, we have a lot of referrals regarding that. We provide traumatic response, and so certainly if a student dies of medical or for mental health reasons, if they've died, we do provide support both from the psych services as well as social workers actually will go out to the schools and provide support to the students and the staff as well, support the staff. And crisis response, I kind of alluded to that. So we have a protocol where if a lot of our administrators and our guidance counselors and child and youth workers and have all been trained in ASSIST, which is a 2-day suicide intervention. Basically, they're aware, you're figuring out what kind of things that are needed, so they know what kind of questions to ask. And so what happens is, at that point, if they feel that a student needs to be seen by a social worker, what they do is they will contact myself, and we'll talk about it, but ultimately we do need the parental consent, because as a parent, you want to be able to, have your child either seen at the school or you can have the child seen elsewhere, but it certainly is a lot easier if we're in the schools, we're able to see the student, and we certainly do talk to the parents, and sometimes we do refer them to the hospital after seeing them, but sometimes we just set up a behavior plan and then, a safety plan and see the student. Sometimes the social worker in the school will end up seeing the student. I just want to let you know that again, because we have so many other things that we do. We do also attendance support, so our social workers are our attendance counselors as well. So that's why they're pretty busy in our schools. One of the ones that we talked about community resources, but what has occurred this year, we just launched our board website on mental health and wellness. And so I just want to highlight it because we've talked about some resources, but there's so many different resources in our community. So I just want to be able to point out where to go find it on our website. So if you go to publicboard.ca, and then for parents, if you link down, you see mental health and well-being. I kind of highlighted it. And certainly under the students, same thing. There's another mental health and well-being, and so our staff has it as well. And so after going there, you can see that you're going to get this website, and you're going to, again, students, parents, and staff, and actually it highlights our board mental health and strategic plan as well. So when you go into the parents section, again, you're going to get where to get help, and that's where there's going to be lots and lots of resources. So you'll have them like counseling, sexual health, homelessness. Like there's a whole myriad of different categories that are under there. And what we've done is, if they have a website, we link their website right into it, so you can look at their programs that they have available. So I can't say enough about it. It's something that's available 24/7 that you can look at it. It does have the information for the walk-in clinics and other places as well. We also have, we consulted with not only the Student Senate, so we talked to students, we've talked to parents, we've talked to staff. And so with regards to the parents, we kind of, with the parent council, we've asked sort of what kind of frequently asked kind of questions. And so we have a category for that, and we answered them, so at that point. We also have resources in there, and so we have apps that are in there, and other, like, there's a lot of apps around mindfulness and mind shift, so a lot of anxiety and depression kind of applications, as well as we also have articles on there. Especially, we're really highlighting, I can't say enough about sleep. I know that the more and more you look in the media, where they talk about how we're all being sleep deprived, not just saying students, but certainly as adults too, we're so sleep deprived, and how important it is for sleep. Because if we don't get enough sleep, it does affect us regarding, anxiety, depression. They're more linked to that. We're spending a lot of time on social media, unfortunately.